and have turned up on time. We're going to get started, and the link we can share later so that for those who maybe have missed the very start, you'll be able to catch up. Okay, so good afternoon, everybody. My name is Kristine Olaris. I'm the CEO at Women's Health East, and I am your MC for this afternoon. I'd like to start by acknowledging that we are each respectively on Aboriginal land that was never ceded, and I'd also like to pay my respects to elders past and present. For those of you who are partner organisations in the Eastern Metro region, you are most likely on the land of the Wurundjeri people of the Kulin Nation, but we also have attendees here today from all areas of Victoria, and also a few interstate as well, and a couple of international guests too. So I will actually encourage you all to use the chat function for those of you in Australia who would like to share and acknowledge the land that you're on. If you can just, if it's not Wurundjeri land, if you can just maybe pop that into the chat and share that. I'd like to pay respect and welcome any Aboriginal people who might also be here as attendees today. And I particularly would like to welcome Leanne Miller, who I do know is coming today. She's the Executive Director of Koori Women Mean Business. A warm welcome to you, Leanne. I'd like to thank Manningham City Council, who funded the forum as a part of their very early COVID response. And I think, you know, just kudos to you for recognising this as an important issue really early on. I'd like to welcome and thank you all, of course, for attending our forum today entitled COVID and Women Shining a Light on Gender, Inequality and the Pandemic. We have had an amazing response to this forum. We've had more than 180 people register, so clearly this is a topic of interest to all of you. We have, because you can't see, I thought I would let you know who's in the room. We do have a lot of our regional partner organisations here today, so that includes the 7 local government areas in the Eastern Metro region. We've got a range of health and community organisations. We've got Yarra Valley Water, the CFA. And then of course we've got similar organisation types to those local governments from a range of other areas across Victoria. We have got a number of our sister women's health organisations here today, so welcome to you all. We've got representatives from government, from state government departments, DHHS and DPC, and also some Commonwealth departments. We've got the Commissioner for Industrial Relations from WA, welcome to you, and many interested members of the public as well. We do have, I believe, one person from the Philippines and one person from the UK. And we've got a couple of Women's Health East board members here too. So thank you for coming. We were particularly thrilled with the response because we think this is such an important topic. So we've got 2 hours together this afternoon. The first hour, we will hear about the impacts of COVID on women from speakers Tanja Kovac and Professor Jane Fisher. The second half of the session, we will focus really on the future, on building a gender equal recovery, beginning with a presentation from Dr. Richard Dennis and followed by a panel discussion and Q&A. You will see on your screen that you have both chat and Q&A down the bottom of your screen. My team, and I think they've already started perhaps, will be adding some links and other bits and pieces of information to the chat that may be of interest to you. But I wanted you to know that we won't be monitoring it for any comments or questions from you. If you have a question you want to pose, please pop it in the Q&A area. We will be getting to those in the second half of the session, but you can start putting them in earlier. But just again, to focus, the questions we'll be looking at on the building of a gender equal recovery. So try and keep them focused there would be great. We have got questions coming through the registration process as well. So we won't be able to get to all of your questions today. We're going to keep, because we're recording, we're going to have a look back at them afterwards. And if there's enough questions or enough with similar focuses, we're contemplate maybe putting together a bit of a Q&A fact sheet that we can share. For those of you who are social media people, and we hope there's a few of you out there, we're using the hashtags COVID and women and gender equal recovery. These will also be in the chat, and if you tag Women's Health East in, that we will also help you share those posts. And just please take note that with the hashtags, we like to capitalise the first letter of each word. It really just makes it more accessible for people who are using screen readers. So if you can try and follow the way that we've got them written in the chat. Okay, I would like to set the scene a little bit for this forum on COVID and women, shining a light on gender inequality and the pandemic. So it's becoming increasingly evident over the last 6 months or so that the coronavirus pandemic is magnifying existing inequalities in our society. At Women's Health East, we have been very concerned about the disproportionate impacts of COVID on women right now and also into the future. It's become clear that this pandemic is not going anywhere quickly and its impacts will also be long lasting. We have been, however, pleased to see that the impacts of COVID on women's health and wellbeing are being measured and acknowledged by media, by academics, by organisations, and to some extent by governments. It's unusual for some reason to see this type of analysis, despite the reality that just about everything is gendered and just about every issue or policy affects different sections of the community differently. So perhaps it points to the magnitude of what we're dealing with. And it's fair to say that the information coming out does paint a rather grim picture for women and girls, and particularly for those women and girls who also face other forms of inequality or discrimination, such as those experiencing racism or ableism, or homophobia, transphobia. It's increasingly evident that this pandemic threatens to drag women's equality and health backwards. And we need to make sure that this doesn't happen. We need to make sure that the same focus that's been put on the impacts of the pandemic are also applied to stimulus spending and recovery. And I guess that's where our main concerns lie at the moment. So COVID-19 does also provide us with a unique opportunity. And I know that sounds like a bit of an odd thing to say about a pandemic, but some of the changes we are seeing in response to the pandemic are altering the way we live our lives, and some are for the better. In addition, massive spending is required to rebuild our economy, and spending over several years. So we can use these opportunities to create the paradigm shift we desperately need to build a more equal, healthier, safer future for all Australians. But to do that, we need to all be engaged, to speak up and to use our spheres of influence, and we all have them. So today, we hope to give you the facts and stats on how the pandemic is impacting on women so that you can feel more comfortable talking about these. And we will together consider what a gendered approach to recovery could look like and how we can use this pandemic to build a gender equal future. I'd like to now commence the first section of our forum, which is focused on the impacts of COVID-19 on women. And first up, it's a pleasure to introduce Tanja Kovac. So Tanja Kovac is the CEO of Gender Equity Victoria, or Gen Vic, the peak body for gender equity, women's health, and the prevention of violence against women. She's an advocate for gender equality and a policy leader with decades of experience working in government, in law, and in non-for-profit sector. Prior to her role at Gen Vic, some of you may have known Tanja as the Chief of Staff for the late Fiona Richardson MP, who was Australia's first family violence prevention minister. And in that role, Tanja was responsible for delivering family violence reforms and creating Victoria's first gender equality strategy. Tanja is a research fellow for gender equity at Per Capita, a director of Emily's List Australia, and on the board of Beringa Arts Centre. She's got extensive experience with media, and her writings featured in The Age, Daily Telegraph, Crikey, Mamma Mia, and more. So Tanja's going to present an overview of the impacts of COVID on women. So over to you, Tanja.
Thank you so much, Kristine, and all of you at the Women's Health East. Before I begin, can I acknowledge the Wurundjeri people of the land of the Kulin Nation, whose beautiful lands I live on. I am a creature of the Outer East, have lived and worked in the Outer East all my life. So I pay my respects to this beautiful land of Kalorama on Mount Dandenong, and acknowledge those elders past, present and emerging. The land was never ceded. Thank you so much for having me today. A little bit, I'm just going to share a screen so that you can see a little bit of information which hopefully will be useful for you to capture, so that you can capture some of the data that I'm going to be sharing with you today. But before I begin, I just wanted to provide a little bit of a background about Gen Vic and why Kristine and the team have asked me to specifically come and speak today. So Gen Vic, for those of you who don't know, is the peak organisation for gender equity in Victoria. We're a relatively new organisation, but we've been around in various iterations for about 15 to 20 years, but our current structure is relatively new. So we're advocating, communicating, coordinating, innovating for gender equity. We've got regional partners, we're supporting organisations, both public, private and community, gender equity professionals and individuals who are committed to gender equity across the whole of the state. And we're changing the landscape for gender equity support, which is coinciding strongly with the Gender Equality Strategy, but also with the emergence of the Gender Equality Act, which will come into force in March of next year. One of the areas that we advocate for very strongly is in relation to gender equity and the economic sphere. We are very determined to ensure that there is a lens on gender economic discussions that ensures that service provision, resources and programs are benefiting the sexes and genders equally. And we do this whether there's COVID-19 disaster or not. Why do we do that? It's not just a rights issue for us. It is good economic and business sense for there to be an equal share of resources in our state and in our country. And I'm looking forward to listening to Dennis reflect in more detail on these questions with you later this afternoon. But today I'm going to focus very much on the statistics of how COVID-19 is really a gendered disaster. It's a gendered disaster from a health perspective, an economic perspective, a housing perspective, a workplace perspective, and a gendered violence perspective. And Kristine has said that basically it's exacerbating existing gender inequities and really shining a light on those. And something that I found really interesting, I've prepared this and delivered this presentation several times over the last few months, but I hadn't updated it in the last probably 2 or 3. And I came back to looking at the most recent sex disaggregated data, and what I was really fascinated to see today is that since we have had this quite significant Victorian spike in the second isolation lockdown in Melbourne and across the state, the statistics around who is being infected have changed from where they were in March and April. So early on, you may have heard a lot of conversation about how both infection rates and death rates were tending towards men having a greater share of being impacted. That is not the case anymore. So if you look at all of the cases and the breakdown of who is being infected, it is women who are marginally ahead of men now. It's very interesting to look across the age breakdowns that you have of infection. Those age breakdowns tell you a little bit of a story of equality in Australia. So the peak of women's infection at age 20 to 29 recognises women's workforce participation pre having children, really, and their exposure in the workforce. And then you can see that there's quite a significant flattening out of that at 30 to 49. So one of the things Kristine said was that, you know, in COVID, we are being exposed to long-term gendered issues, but the pandemic is actually exposing and showing us things about sex disaggregated data and sex and gender impacts that perhaps we wouldn't see previously. Likewise, in terms of the death rate, it is now very clear that it is women who are dying in greater numbers than men. And probably the most, again, this is a complete reversal from where we were a few months ago. So it's really interested to see how this has changed. What has been the impact here? Well, clearly what we're seeing is that aged care deaths are women's deaths. So you can see that where the biggest spikes are and where women are dying is in residential aged care facilities. Just to drill down a little bit further, if you look at the actual Victorian death rates, you'll see that overall it's at 52% versus 48% for men, and that you're looking at 53% for women over the age of 70, men and women over the age of 70. So, you know, look, that's quite significant. All gendered and sex disaggregated data is significant. When the statistics were flipped, I was saying that, you know, it's fundamental in a pandemic like this that you have sex and gender disaggregated data. It's usually women's organisations who call for that, because we're always wanting to see how there is a differential impact. But it matters whether it's men or women who are the ones who are dying or infected. There are biological differences in how you react to various different diseases. And so it's important that we have that public policy officials and you know, healthcare professionals understand the differences and track them. So we really commend to all of you about using COVID-19 to continue your advocacy around the importance of sex and gender disaggregated data. I won't touch on this in great detail because we are going to hear in greater detail about the mental health component, but it's not just a physical health impact. What we know is that women are actually bearing the greater burden in relation to mental health impacts. And I'll just focus in on one particular statistics which I found really alarming. If you a 2,800% increase in demand to the Alfred's mental health clinic for women. I mean, that's just extraordinary. That was in 1 month. So, you know, we're talking about quite a significant impact for women. COVID-19 is also impacting in other ways in so reductive. We know from the 1800 My Options service, which is provided by Women's Health Victoria on behalf of the state, which usually provides support and assistance to women who are seeking advices about termination and pregnancy options, that they are making decisions to delay the presentation in relation to choice beyond the usual 12-week early stage of pregnancy. So there's the pandemic has caused an overall general fear to engage in health service provision and support. And in relation to sexual and reproductive health, obviously that's a significant concern because it has an impact on when women are seeking out support if they're going to choose to potentially terminate a pregnancy. It's also contributing to challenges around the actual service provision of SRH. So, you know, if you can't afford to pay for these services because you've lost your job, in circumstances where the providers of them are not outside you know, the realm of you being able to access them. So they, particularly if you're in a rural and regional location and you can't get to a sexual and reproductive health provider that is nearby during lockdown, you know, this is going to have an impact on women's capacity to basically have access and to have choice. We also know from 1-800 My Options that there's just been a general anxiety around pregnancy, and that this is having some other interesting health consequences. So there's been a significant increase in and interest and take up in home birthing. So we've gone from a sort of 4% interest registered by the College of Midwives to 26%. So that's a huge jump. We also know that that women are also avoiding access to breast cancer screening. So in addition to, there's just a general desire to stay away from health services, which is understandable in a pandemic. And the long-term health consequences of this for women, we won't really know, I think, for a few years. Not all of the gendered health impacts are negative. So research from Denmark and Ireland is revealing that there's actually been an odd decrease in the number of premature babies. So that decision to try to stay away from hospitals is also meaning that we're not having so many premature babies. What is that about? Is that about the fact that that women are more comfortable at home in isolation with less travel responsibilities associated with work? Is there a psychological factor in it? It's going to be very interesting to see some research into understanding that. The gendered health consequences go beyond, though, the actual people who are impacted by COVID-19. It's also a gendered health problem from the perspective of the workforce. So the people who are doing the caring of people who are exposed to the virus and ill are largely women. And we've discovered that essential service workforce, that the workers that provide the scaffolding of all the other economic activity in Australia, they're women's workforces. And they're often the workforces that are the poorest paid. So, you know, this is a fascinating challenge for us as a country to reflect on what is the meaningfulness of this when we move into the recovery phase. What is the meaning of this when we talk about future disaster preparation? Again, I won't touch on too much about this because I think Richard will deal with this a little bit more, but it's definitely the case that, you know, in terms of the economic job loss impact, that women are bearing the brunt of COVID-19. One thing that I did want to leap out, because it's an issue dear to my heart, the state government performed an important piece of research about nearly 18 months ago now, looking at the value of unpaid labour in Victoria. And so one thing we know already, even without COVID-19, that the value of unpaid labour in the home, whether that is caring for children or doing domestic duties, the value of it is $205 billion per year. That is 4 times the size of the state budget, which is the biggest business in town. So when we talk about the fact that a disaster is actually increasing women's unpaid care work, we're talking about an already very difficult economic situation for women being massively exacerbated on a daily basis. This care economy question, which is and dealing with it, which is an essential part of why we why GenVic advocates for a gender equal economy, whether there's a disaster or otherwise, is one of the things that we have a chance to build back better about. And it's not necessarily an easy conversation, but again, look forward to having that this afternoon. COVID-19, social housing problem. When you're talking about the 9 towers, you're talking largely about women being displaced and exposed to the ravages of governmental action to restrain the virus across those houses. Victoria has the lowest proportion of public housing of all Australian states. So, you know, we need, you know, when you're talking about a pandemic, the people who are being impacted in a social housing framework are largely women, because they're the majority. 55% of the users of public housing are women. And when you're talking about where should investment be, where is the job-ready stimulus, where are you going to get the biggest bang for your buck to create great solutions for that, you know, create jobs and also build infrastructure, social housing provides a really important means for addressing a gender equal recovery that's meaningful on many fronts. And of course, COVID-19 is also a gendered safety issue. So, you know, the statistics have been telling a story. Initially, Safe Steps, which is the contact line for anyone who's impacted by family violence, it actually showed a slight decrease in calls, and there was a concern that reflected, you know, the inability of victim survivors to actually pick up a telephone within a lockdown environment, and so there was a great concern about that, about Safe Steps seeing that drop. It has flattened out now. There's an interesting situation that it does seem to be that there's a higher spike of bystanders using that telephone service. So there's clearly still an issue about how do women who are, you know, locked in homes with a perpetrator reach out to the support services that they need. And there are some innovative solutions associated with, you know, outreach of services into you know, shopping centres and retail in order to facilitate connection that, you know, otherwise wouldn't be able to be done within the home. I think the most interesting thing is just the recognition by men that they're struggling with COVID. And so there's been like a 94% increase in access to men's services that support men to address gendered violence. So they're very conscious of the need for help and are reaching out and looking for that help. Thing is about a disaster, whether it's a pandemic or otherwise, we know in Victoria that a disaster is a deeply difficult issue because force men and women to retreat to their usual gendered roles. So men feel under pressure to be saviours, superheroes, and women feel under pressure to conform into a caring role. When there's a conflict in a relationship where either one of either the man or the woman starts to, you know, want to behave in one of the different those different stereotypes, and it creates conflict in a household. Now we know about this. We know about this tendency towards gendered stereotypes because Victoria has got world-leading gender and disaster research and support capacity built from the Black Saturday bushfires. That leadership comes from women's health services that are in all the regional locations of Victoria. But this particular project, which was established by Women's Health Goulburn North East, Women's Health in the North, and also the Monash University Disaster Resilience Initiative, the GAD pod, It's won awards all over the world and at a national level that are about exploring the connection between gender and disaster, and just how problematic that is for incidences of violence. So I guess it can look like a bit of a grim picture, and you know, Kristine hinted that that was the case. It's Gen Vic's role to work with community organisations, the private sector and the public sector, to think through innovatively what are the solutions to that. How can we work together to think of a revision of what needs to happen to address those challenges and build back better? So we've been focused very much on that over the last 6 months. You too can be involved in that journey with us. Sign on to Gen Vic's Gender Equity and COVID-19 joint statement. We've got 106 organisations who've signed up to that, which has basically got like a 10-point plan of what government can do to implement a gender equal recovery. We've made submissions to the Public Accounts and Estimates Committee, and we'll continue to deeply advocate for a gender equal recovery, and we're starting to see some shifts in the dialogues from both the state and federal government. Share our fact sheets, our infographics and other social media tiles. We've got 5 really great fact sheets on sexual and reproductive health, gender equity, violence, mental health. Log on to our website and you can get access to those for free. Keep up the calls for a gender equal economic recovery. This is about good business. This is not just about because it makes you feel good. This is actually because it's the way for us to have a really great Victorian recovery. Be a champion for collecting and analysing and reporting on sex and gender disaggregated data. And if you would like to follow for free Gen Vic's Gender Disaster and Resilience e-update, we are providing really regular e-readers which collect data from all over the world around the impact of gender and disaster. We've had a number of special editions that look at the nexus between bushfire recovery and the pandemic. We've looked at the impact in the arts community and the pandemic. So yeah,
I'm going to have to wind you up there, Tanja, I'm afraid. You're at the end there of your.
That's it, Kristine.
Thank you so much. That was fantastic. And I would now like to introduce. I can't hear.
Kristine, you're muted.
There we go. Am I speaking now? You can hear me. My apologies. Professor Jane Fisher is our next speaker. Jane is an academic clinical and health psychologist. She's the Finkel Professor of Global Health and the Professor of Women's Health at Monash University in the School of Public Health and Preventative Medicine. She has long-standing interests in the social determinants of health and in healthcare participation. And with colleagues, she has recently undertaken a national survey of the psychological impacts of the first month of COVID-19 restrictions, and a second survey which was wound up at the end of August. So Jane is also a guest presenter with Raf Epstein on Life and Other Catastrophes, a segment on ABC Melbourne Drive each week about experiences and relationships, which has for the past 3 months enabled community discussion around the impacts of COVID restrictions on people's lives. So today, Professor Jane Fisher will discuss the latest findings from the National Living with COVID-19 Restrictions in Australia survey. Thank you, Jane.
Well, thank you very much. I would just like to share my screen. And thank you so much for the opportunity to join this important discussion, and thank you very much, Tanja, for the important insights which I'm most interested to talk with you about in the discussion part. We've all had to adjust to major changes in our daily lives to comply with the COVID-19 restrictions, and inevitably these influence our mental health. but the nature and intensity of mental health consequences is really shaped by our social and economic circumstances. And at the time we launched this survey, there were no national data available to inform policies and programs about the mental health of people in Australia. So what we did was seek to estimate how common clinically significant experiences of depressive and anxiety symptoms, thoughts of being better off dead, and increased irritability were in the Australian adult population. And we looked at COVID-19 experiences in 4 ways. We asked about job loss. We asked about whether people had had a direct experience of the virus in terms of being treated or tested for it, or whether they were caring for people who'd become sick, either in their professional work or in their domestic lives, and how worried they were about contracting the virus, and also whether the restrictions had had an adverse impact on their day-to-day lives. And we sought to understand the relationships between these two. So we launched on the 3rd of April this year a short anonymous self-report survey that was to be completed online. All Australian residents over the age of 18 were eligible, and it included both study-specific questions about circumstances and some widely used standardised self-report measures. Indeed, some of you may have been generous enough to complete this survey. But in total, nearly 14,000 people completed it, which was more than 90% of those who actually opened the survey, which indicated how interested and concerned people were. They were drawn from right across the country. We had women, men, and people who did not identify as either female or male completed. There was a very wide age range, and they were from all socioeconomic positions. Now, at that stage, which was in the first month of restrictions, about 15% of people had had a direct experience. Fewer than 1% had actually been infected, but others had had these other associations with the virus. More than 10% had already lost a job because of the restrictions. And you can see the proportion of people who were either worried about contracting the virus, but in particular, 1 in 4 said the restrictions had had a very adverse impact on their lives. Because it's not possible to identify a group in Australia who were unaffected by the virus, we had to turn to studies that had used the measures we used to try and get comparison estimates of these more severe and mild symptoms. And if you can see the highlighted section, these are studies from Australia and other high-income countries that had used these measures, which tell us that between about 3 and 10% of people in usual times will have clinically significant symptoms of depression or of anxiety, and about between 1 and 2% will express thoughts that they'd be better off dead. But if you look at the right-hand column here, you will see that we documented an extraordinary elevation in these experiences. 27% said they had clinically significant symptoms of depression. A very high proportion had clinically significant, which means that it was causing them some disability, experiences of anxiety. A high proportion, nearly 15%, said they'd actually had thoughts that they'd be better off dead than they were in the circumstances they were in. And nearly 20% said that they were becoming more easily annoyed or irritable, at least on some days of the week. And it wasn't only those with these more severe symptoms. If you can see from here, in addition to those, about 1 in 4 or 1 in 5 were experiencing mild depressive or anxiety symptoms. Nevertheless, nearly a third said they still felt pretty optimistic about the future. When we looked at the relationship between these two, any number here that's bolded tells us that the relationship is significant. But just to draw out a couple of illustrative examples, what this tells us is that people who'd lost a job because of the COVID restrictions were 50% more likely to have clinically significant symptoms of depression. And people who were experiencing the restrictions as having a very adverse effect on their lives were more than twice as likely to have thoughts of self-harm or that they would be better off dead. So I want to just show you briefly a comparison in the prevalence of these experiences between women and men. You'll see that many more women completed the survey than men did, but these asked about experiences in the past 2 weeks, and there were enough numbers for us to make these comparisons with confidence. So women were significantly more likely to have clinically significant symptoms of depression and anxiety. Many more women than men said they were feeling increased irritability. And I think of concern to us is that significantly more women than men said they were turning to alcohol. They were drinking more than usual during this time. But there was no significant difference in the prevalence of people who said they were having experiences of thinking they were better off dead. And the factors associated with these outcomes will be of no surprise to this audience. So women were significantly more likely to be doing unpaid work caring for children, but also to be caring for other dependent relatives, either because they were aged or because they had a disability. Women were also significantly, that there was the same proportion of women and men who'd lost a job. They were much more frightened of contracting COVID, and more women said that the restrictions were having a highly adverse impact on their lives. So what these data indicate to us is there's been a whole of population shift in mental health. All of us are affected by this. There can't be an other group and a group who are unaffected. But there have been marked increases in both mild and more severe symptoms. And the people most vulnerable to the more severe symptoms are people who've lost jobs, who live alone, who live in the least well-resourced areas, who are providing care for children or other dependent family members, or are young, or among some groups are older, and more of the people with all of these experiences were women. And you might say, well, why is this a problem to the community? And it's because if you have this level of psychological distress, you're not able to function in the way that all of us would prefer to function. So with these problems, people have lowered levels of ordinary efficiency and decision making. Drive and vigour and energy are reduced. Capacities to plan, organise and find solutions are lower. Concentration is poorer and ability to engage with others is worse. And these are the capacities that we all need in order to be able to recapture and restore healthy functioning. So in my opinion, it's not helpful to take a psychiatric conceptual framework to this. I believe what we're documenting is a normal human reaction to very abnormal circumstances. And I think we need to be very cautious about labelling this as a sick state. I think these circumstances have challenged everyone's adaptive capacities, and they've reduced people's access to the protections of interactions and social relationships and opportunities to participate both socially and economically. We know that anxiety usually increases in circumstances of uncertainty, risk or danger. And I think the fact that we've all had to live with uncertainty about how long the restrictions would go for, and for some decisions we've had very little understanding of the evidence underpinning it, that this has contributed to the pervasive increase in anxiety. We know that depression is almost always associated with experiences of entrapment and humiliation. And I think it's not too difficult to stretch, as we're all entrapped, to imagine that the humiliation of job loss, isolation, unending unpaid work contributes to the circumstances in which a depressed state of mind develops. I think it's also helpful to think about some other psychological constructs which might enable us to understand this. The first is disenfranchised grief, which is grief for formless losses that are not accompanied by public ceremonies or rituals as they are after bereavement. But we've all lost autonomy, liberty, we've all lost capacity to participate in events that would otherwise be of enormous significance, so milestone events, important family ceremonies and events like weddings, but in particular, we've lost capacity to accompany others who are ill or who are dying, or to be able to attend funerals. Young people have lost things of importance in terms of their own social transitions, from young person to adulthood, through leaving school, through finding work and being able to leave home. So there are many losses that we've all had to adjust to. But also demoralisation. And I think this is what accompanies a state in which we feel helpless and powerless. And I think if we can think in these broader ways, these will give us some ideas about what we need to do to assist psychological recovery. So the public policy response at the moment, it's been important, but it's been to increase clinical services. So increase access to telephone helplines, to telephone counselling, increased numbers of sessions with mental health professionals, and encouragement of primary care providers to assess mental health, especially in people who are vulnerable. So all of these are legitimate activities, but I just do not believe that they are sufficient. And I think we really need to put our concerted efforts together to think about a public health response. So we've needed a public health response to contain the virus. I think we now need a public mental health response, which thinks carefully about what is it that's needed for the whole population, what are the lower intensity interventions that can be provided in terms of self-management, and there will be a small group who need higher intensity services. But in my opinion, it's essential, as Tanja has already argued, that this is a gender-informed mental health response. So I think we have to think of engagement well beyond the health sector. We have to think about what civil society and industry and non-health sectors in government can do. We have to think about task shifting, and I believe it's crucial that this is an opportunity for us to build the psychological skills of much broader services than just health sector services, so that they can become more skilled at empathic listening, at shared approaches to problem solving, and in providing services that are not humiliating. We have to attend, as has already been argued, to the inequities in the division of unpaid caregiving and household work, and we have an ideal opportunity here to do this. We have to attend, as Tanja's already argued, to personal safety, and I believe that all initiatives that are taken for recovery should be measuring whether they have benefits on mental health as well as other economic and health benefits. And I look forward to discussing these with you in the discussion session. Thanks so much. I also have to thank the many people who worked on this big project with me, and the funding that we received from Professor John McBain and Dr. Penny Foster to do this work, and to the Finkel Family Foundation who support my position. Thank you.
Thank you very much, Jane. That was fantastic. I have a message that Richard Dennis is just... Oh, I haven't been muted by the host. Now unmuted, thank you. I have a message that Richard Dennis is just joining us, so hopefully he'll be here any minute. I will introduce him in the hope that he arrives by the time we get to that. But we're now moving into the second part of the forum, where we start to consider what a gender equal recovery could look like. So our next speaker is Dr. Richard Dennis. He is the Chief Economist and former Executive Director of the Australia Institute. He's a prominent Australian economist, author and public policy commentator, and a former Associate Professor in the Crawford School of Public Policy at ANU. Richard was described by Mark Kenny in the Sydney Morning Herald as a constant thorn in the side of politicians on both sides due to his habit of skewering dodgy economic justifications for policy. Prior to his appointment at the Australian Institute, Richard was the Senior Strategic Advisor to the Australian Greens leader, Senator Bob Brown, and also Chief of Staff to Senator Natasha Stott-Despoja, former leader of the Australian Democrats. He was also a lecturer in economics at the University of Newcastle. Richard is a prolific writer with regular columns in the Australian Financial Review and The Guardian, as well as he has writing regular essays for The Monthly, and he has written 5 books that you can check out. And he's going to talk today, presuming he turns up in a moment, on the gendered approach to economic recovery. So, given that he's not here right now, I'm just going to ask a couple of questions of the speakers we've had so far. So, Jane, I might pop to you actually. We had a question that came in from the Inner East PCP particularly about older women and COVID. And I'm wondering, from your perspective of your research and just your background in social determinants of women's health and wellbeing, if you could tell us a little bit about the mental health impacts of COVID and what we should be trying to do in that space in terms of, you know, moving forward into the future.
Look, it's an excellent question, and I think incredibly important. While there's been a focus in a lot of the public discussion on the needs of young people, that we really hold closely in mind that the needs of older people are also of great importance. In our research, we were struck by 2 things. First of all, the average prevalence of people saying the restrictions had a very adverse effect on their lives was lower among older people. And in trying to understand this, people said to us, well, look, older people have lived long lives. They know that difficult circumstances pass. They bring wisdom and maturity to these situations. And perhaps for them, they're more accustomed to living with these kind of restrictions. Notwithstanding that, there are many older people, in particular older women, who are living alone. And for them, I think this has been an especially burdensome experience, not being able to see family members, especially grandchildren and others. For those who don't drive or who rely on public transport, it's been extremely isolating, not being able to use public transport and being restricted to their homes. So I think we do need to consider very carefully the needs of this group of people who are actually quite silenced in the kind of surveys we did, because they might not have confidence in using online or other technologies, and that older people, especially those who live alone, should be actively and explicitly included in strategies and services to assist psychological recovery, especially their capacity to be re-engaged in important social relationships and enabled to resume the purposeful activities that give all our lives meaning, but very particularly give meaning to the lives of people who are no longer in the workforce.
Okay, thank you. And Tanja, maybe I'll get you to answer one as well. This one's from Women's Health Victoria. And I think you've kind of touched on, or you've touched on quite a bit about what Gen Vic's up to, but what is happening in terms of advocacy to government about a gendered response to COVID recovery?
Thanks, Kristine. Look, I think that there, thanks to quite a lot of advocacy at a national and state level, I do think that we're starting to see government be far more aware that it needs to have a gender lens over its economic stimulus. So one of the things that we did, that we have been observing, is a sort of a mismatch between an understanding of who's impacted in terms of job losses. So job losses due to COVID-19 are skewing towards higher numbers of women being unemployed than men. And that's a national statistic, and it's significantly higher in Victoria than the national average as well. And so early on, there was the usual sort of Treasury inspired decisions around, basically focused around the construction industry. These are the tried and trusted ways in which to stimulate economic activity, and where you would generally direct resources of the state towards job creation. There seems to be a bit of an understanding that you can't just have like a sort of a hard hat fluoro blokey investment strategy. We are going to have public sector service provision investment. Traditionally, the economic rational view of recovery would skew away from that kind of investment. But if you want to have gendered job creation, we are going to have to invest in social housing. We are going to need health preventative workforces. We are going to need gender and disaster recovery workforces. So I think on the whole, I think government is moving, but it's going to take, it's a slow process. In my view, we should be way more advanced in our discussions around gender economic theory, even without COVID-19, than we currently are right now. So, we're already behind the 8 ball.
Thank you very much, Tanja. Just remind people, if you have got any questions, you can add them to the Q&A, and we have now got Richard has joined us. So Richard, if you can pop on your camera and unmute yourself. We've already introduced you, so you can jump right in.
Hi, how are you? And I'm terribly sorry to keep everybody waiting. My oh, that's a bit better. My 9-year-old, who's in the background here, just had an accident at the playground, and I was required at short notice to pop up and bring him home. So apologies. Look, big picture, what I want to do is talk about the shape of this recession, the size of this recession, and in particular focus on the consequences and the implications for women, and of course for the economy as a whole, because if our policymakers don't pay sufficient attention, I don't know what the right adjective is here, but let's say sufficient attention to the people on the front line of this crisis, it's not just women on the front line of this crisis that lose out, it's all of us. So let me start with the big picture. In 1991, the last recession we had, the size of the economy, the size of GDP shrank by 1.5%. So the recession we had to have, the last recession really in most people's memory, saw the size of national income, the size of our economy fall by 1.5%. So if you picture a wave hitting the economy, that wave was 1.5% high. Well, we've just been hit in September by a wave 7% high, more than 4 times bigger than the recession, the entire recession that we saw in 1991. Now, this is enormous, and it's interesting the way our psychology works. We were told to expect that GDP might shrink by 10% or even 8%. So when the news came out that the economy had only shrunk by 7%, a lot of people thought that was good news. A lot of people thought that was the economy performing well. And just to be crystal clear, I would much prefer the economy to shrink by 7% than 10%. But again, in 1991, the entire 1991 recession saw GDP fall 1.5%, and we've just seen it shrink 7% in 1 quarter. And the recession's not even over yet. So the size of this pandemic-induced economic disaster it's unheard of in modern Australian economic history. And the fact that it was slightly bigger in another country is irrelevant. The fact that it's slightly smaller than it was expected to be is irrelevant. We are experiencing the largest economic shock that we've seen in Australia. That's problem number one. Problem number two is that this recession is quite different to other recessions because usually a recession comes after a boom. So usually you hear people talk about a boom and a bust cycle. So you have a boom and then you have a bust. Well, the Australian economy was actually doing pretty poorly for the last 7 years, and now we've fallen off this cliff, this 7% shock. So we came into this recession with low wages growth, low productivity growth, low GDP growth, and we've been hit really hard. And then the other thing that's really important is that from a policy point of view, a lot of this recession is policy induced. We've deliberately shut down the tourism industry, which, by the way, has a very large proportion of women working in it. We've deliberately shut down the tertiary education export industry, which has a very large proportion of women in it. We've had to shut down huge parts of the entertainment industry, which has a very high proportion of women working in it. So in order to make me safe, in order to protect me and my family from a highly infectious novel disease, we're imposing economic costs on what we call the community. But actually, we're imposing economic costs on parts of the community. And to be clear, my part of the economy has not been adversely affected at all. I have had zero economic costs of the response to coronavirus, none. I have been inconvenienced in some ways, as has everybody. I've been scared, I've been worried for my friends, my parents. I'm not saying I haven't experienced any costs, but in terms of financial costs, I've had none. But young women working in retail and older women working in aged care are experiencing enormous disruption, either financial or that they're now working in a very, very dangerous workplace for some of the lowest wages in the country. So we have to be very careful when we talk about these issues. We talk about the economy and we talk about the labour market as if it's one thing. But of course, the economy is just the sum of all of its parts. And it's just not true to say that we're all in this together. It's not true to say that we're all experiencing economic costs, because I'm not. My income hasn't fallen at all. And that's true for a lot of people working in a lot of industries. My income hasn't fallen. The government's talking about giving me a tax cut. Giving me a tax cut isn't going to be particularly those who are on part-time and casual work, particularly those who have missed out on JobKeeper and JobSeeker. I'll come back to that in a minute. So point one, this recession is enormous. Point two, this recession is in part caused by the introduction of public policy measures to suppress economic activity in parts of the economy that are not evenly distributed. They're carefully selected. And those carefully selected parts of the economy happen to be carefully selected parts of the economy in which women are disproportionately represented. Then we've got the policy response today. We've got unprecedented levels of government spending, which I support entirely. We can maybe chat about that with Q&A, but the government spending to date has been unprecedented in its size, but it's been targeted quite deliberately. It's been targeted in ways that, again, disproportionately help blokes, excuse me, and the groups that are most left out are disproportionately female. And what do I mean by that? Well, the job keeper policy is quite generous. It's arguably been given to some industries that perhaps don't even need it. But the way it's designed, it's focused on people who are in either full-time work or people who were part-time or casual but had worked in the same workplace for more than 12 months, an entirely arbitrary decision. But the consequence of that entirely arbitrary decision is that a lot of casuals, and particularly casuals who move around between jobs, have missed out on the very generous job keeper payment. Well, guess who is most disproportionately found in that end of the casual labour market? It's women again. So we're in the biggest recession we've ever seen in modern history. We've imposed costs on specific sectors in order to make me and my family safe. And those sectors are not predominantly, but disproportionately female. Some of them are predominantly female. And then when we design our stimulus package, our support package leaves out a key group, and that's casuals, and particularly casuals that don't have continuity of employment in one workplace. And again, unfortunately, it's women that are most affected there. And then the final problem, which sort of brings this sort of full circle in terms of where we're at, the final problem is that in addition to these sort of support policies like JobKeeper and the temporary supplement for job seeker, so much of the conversation about stimulus, so much of the conversation about how the government can sort of help the economy revolves around spending lots of money on infrastructure projects and building things. Now, just to be clear, I'm fine with building things. Building things is better than not building things. But when we spend billions of dollars building a road or a bridge, we're actually spending billions of dollars buying enormous amounts of concrete as opposed to labour. We're spending an enormous amount of money renting capital equipment rather than employing labour. So economists have the idea of what's called the labour intensity of different activities. And an easy way to think of labour intensity is to ask, well, for every $1 million we spend, how many people would we employ? How many people per $1 million? Now, my colleagues and I at the Australia Institute have done quite a lot of research on this. Happy to share a link or something afterwards if people are interested. But to cut a long story short, per $1 million spent, the most labour intensive thing you can do is education and childcare. And the second most labour intensive things you can do are health and aged care. And to give you some broad numbers, for every $1 million you spend in the education sector, you create around 14 jobs. For every $1 million you spend in the childcare sector, you create around 10 jobs. And for every $1 million you spend on construction, you create less than 2 jobs. Building things that we need is a good idea. I drove my car on a road today. I am not anti-road. But the idea that the best way, or indeed the only way, to create jobs is to spend billions of dollars on roads is absurd. It has nothing to do with economics at all. It highlights what a blokey notion of jobs we have in Australia. Jobs has sort of become a political symbol rather than an economic descriptor. So we have this kind of hard hat and high vis notion of real jobs, and real jobs pretty much involve blokes in mines and manufacturing and building sites, not anti-mine or anti-factory or anti-building site. But let's be clear, 80% of Australians don't work in these blokey industries. 80% of Australians work in the services sector. And there's nothing unreal about a job in the service sector. I was on the drum last night talking about similar stuff, and I made the point that by this, if some jobs are real, no one on the panel on the drum last night had a real job. 80% of Australians don't have real jobs. There are whole countries like Singapore that have no mining industry and very, very small amounts of manufacturing. Do we actually think that there's whole countries that don't have any real jobs in them? So this idea that there are real jobs and governments should support the proper jobs with stimulus, it's politically convenient. It means we end up spending a lot of taxpayers' money buying new mines, buying gas-fired recovery talk you might have heard of. Gas is the least labour-intensive industry in Australia. Oil and gas industry employs less than one person per $1 million spent. So we have this kind of distorted conversation about how to create jobs. Now, and it's a big if we wanted to create jobs in Australia, what we would be doing is looking at all the things we could buy. The government is literally spending hundreds of billions of dollars in stimulus. Good, I'm happy about that. Virtually every economist in the country is. So if we're going to spend hundreds of billions of dollars, from my point of view, from an economist's point of view, from your point of view, if just citizens interested in good policy, every $1 million we spend, we should ask the question of all the things we could spend it on, which things would create the most jobs? And of all the things we could spend it on, which things would deliver lasting benefits for us? And we might decide to build some roads, and we might decide to build some bridges. But it's pretty obvious to me that we should also decide to spend a fortune on childcare, for example. There's overwhelming data that suggests that if Australia had a childcare system with free or very low cost childcare in the way that the Scandinavian countries have it, that the proportion of women entering the workforce would be significantly higher. And that means in the long run, GDP would be significantly higher. So there's overwhelming economic evidence that says when we spend money on things like childcare, we get it back with interest. There's overwhelming evidence that suggests when we spend money on good education, we get that money back with interest. The idea that if we just spend money on roads and bridges, they're the only things that deliver lasting benefits, is absurd. And it's certainly got nothing to do with economics. So to recap, we've seen the economy fall into the biggest hole or fall off the biggest cliff, depending on the metaphor you prefer, the biggest one we've ever seen. I finished uni in 1991. I came out of university straight into the recession we had to have. The recession we had to have saw GDP fall 1.5%. We've just seen GDP fall 4 times more than that. We've got overwhelming political consensus that the best response to this is for the government to spend a lot of money. For decades, we've been told that budget deficits are bad. For decades, we've been told repaying government debt is the be-all and end-all. Well, here we are in Australia in 2020 with the Liberal Party, the National Party, the Labor Party, the Greens and the Crossbench all agreeing, every single one of them agreeing that government borrowing to boost economic activity is the right thing to do. So as an economist, this brings me enormous joy. It's very rare that me and my colleagues can all agree with the vast majority of parliamentarians. Labor, Liberal, Green, National, One Nation, Jackie Lambie, you name it, everyone agrees the government should be borrowing money and spending money. What we don't agree with each other on, which is fine, it's a democracy, is what we should be spending it on. And I guess my plea to everyone listening today, my plea to you is to take seriously what I'm saying here. There's a huge opportunity for not just you as advocates for particular kinds of spending, but just you as citizens in a functioning democracy. Sorry to sound grandiose. For the first time in my adult lifetime, we're not being told, yes, I know you'd like to spend some money on something important, but the big kids have decided that we need a budget surplus. For the first time in my adult life, we are not being patronised by people saying, yes, I know it'd be nice to spend more money on essential services, but we have to repair the budget first. Gone. That's all gone. No one's saying that. Everyone agrees we should be spending hundreds of billions of dollars to stimulate the economy. The only thing that's up for grabs, the only thing we're haggling about is what we should spend the money on. Now, we can just keep paying out JobKeeper. It's not the end of the world. It's propped up the economy quite effectively. If we really want to cut JobSeeker, we could do that. From an economic point of view, what a terrible idea. Every dollar we give to the unemployed people will be spent. Their poverty virtually ensures this. But the government's saying, no, I want to cut JobSeeker and give Richard a pay rise. Right? By cutting my tax rate, you're boosting my disposable income. Well, that's nice. If people want to stuff money in my pocket, I won't actually pull it back out. But when you give me $100 a week pay rise, I'm not going to spend all 100 of it. I already saved some of my money. I'm comfortably middle class. So economists call this the propensity to consume. We know that low income people have a much higher propensity to consume. Give them an extra dollar, they'll spend $1. Give me an extra dollar, I might spend 20 cents of it. So we've agreed that we're not worried about the budget deficit. We've agreed that we're going to spend hundreds of billions of dollars. What we haven't agreed yet is on what. And, you know, people often talk about the size of the economy, or they talk about the amount of government spending. I think it's far more economically important and far more democratically important to talk about the shape of government spending and the shape of the economy. What parts of the economy do you want to grow? What parts of the economy are you happy to see decline? They're interesting democratic conversations, very important democratic conversations. They're also very important economic conversations. Because again, to go back to where I started, we know this recession is huge. We know it's disproportionately affecting women. And we have agency, we have power, we have discretion when we decide not how much money to spend on stimulus, because everyone agrees we should spend hundreds of billions, but on what? And I would say, both as an economist and as a concerned citizen, they're quite separate things, that if we look at those two criteria, labour intensity, how many jobs per $1 million spent, and lasting benefits, what do we get out of this if we do this now? I would suggest that we would get far more bang for our buck for economy in the future if instead of giving me a tax cut, we spent that money making childcare free. No problem with that. We've got all these young people who aren't going to be able to get a job. It's terrible. I remember it. They were the worst days of my life, really, being unemployed for 2 years straight out of uni. Why don't we make university education free for a couple of years? Why not say to all young people, hang on, we know there's no jobs for you out there. Come on in. You know, now is a great time to give you an education because we know there's no jobs for you. So whether it's free childcare, whether it's a big boost in expenditure on aged care, whether it's free university, not just for young people, but just people who know they can't get a job and would like some skills, we have discretion. We as citizens have discretion. My job as an economist is to put options in front of you. Your job as voters is to let people know which you prefer. But to conclude, we know that female-dominated industries have been hit hard. We know that the casual labour market has missed out on a lot of the support. We know that female-dominated industries like entertainment haven't been looked after nearly as well as male-dominated industries like construction. But leaving all that aside, we collectively have to make some big decisions about what do we want to spend more money on. And if we focus on labour intensity, if we focus on lasting benefits, I think we'll end up spending a lot more money on services. And just to be clear, that's going to create a lot of jobs for blokes too. Okay, when you spend $1 million on education, not only do you create a lot of more jobs than when you spend it on construction, you actually create more jobs for men when you spend money on education than construction. All right, so it's not that we actually have to choose between men and women, but if we choose between labour-intensive jobs and capital-intensive jobs, if we choose wisely, we'll create a lot more jobs for everybody. Now, I've been talking into a blank screen for quite some time, so I'll shut up there and take some questions, I hope.
Thank you very much, Richard. Okay, so I might get all the panellists to join us now. And we will remind people you can add questions in the Q&A. We've just got one in there at the moment, but really try and, if we're looking in this section, to really look at how we can build a gender equal recovery. So please feel free to jump in, but I have got some questions that people have sent through earlier as they registered that I might start with. Richard, I might start with you actually. We've asked one of Jane and Tanja already. We know, just really thinking about young women, we know that there have been a lot of women taking up the option of early release of some of their superannuation, and I'm just wondering if you can give some, I don't know about advice, but explanation to young women thinking about that, about what the long-term implications of that might be.
Yeah, look, it's a good question, and it's a hard question, and yeah, I wouldn't give anyone financial advice, but the way the government has designed this early access to super, I think is flawed in lots of ways. Just to be clear, the government just gave tens of thousands of dollars to lots of small business owners and just said, here, we're worried about you during this crisis, here's some money. They didn't make that decision for a whole bunch of women working in casual work. So step one, again, we have enormous discretion. We have have a wide range of options in front of us. We didn't have to jump straight to, we can help you get to your super. We could have just been generous to people. We could have just said, look, we're making cash grants to people who need them, apply here. So step one, we're not treating everyone evenly. A whole bunch of small business owners, a whole bunch of sole traders wound up with some quite generous support, a whole bunch of employees didn't. And then the way they've designed this is to sort of say, look, there's this window, and if you want to apply for emergency access, now's the time to do it. And if you don't do it now, you miss out. So I can understand why a lot of people thought, well, I don't actually need the money now, but maybe in 6 months I will, and maybe they won't open the window again in 6 months. So I think a lot of people have accessed the super, understandably, because they think, well, if this is my one chance to get my hands on it, I don't know what the future looks like, I better grab it now. But once the whole point of super is, you put money away, you'll need it later, I think a lot of people, having taken it out, have put it in the bank and thought, I'll just save that. But, there's a lot of temptation there, and there's no doubt that some people have gone off and spent some or all of that money. Now, that's not the end of the world, but people need to understand, individuals need to understand, and policymakers need to understand the long-run consequences of that. Women are incredibly disadvantaged in the superannuation system. One of my favourite talks I ever gave is on the lies men tell women about superannuation. If people want to Google it, you'll find it. The whole superannuation system is stacked against women, and women already retire with far less than men. The way they've designed this access has just made what was a big problem even bigger. So I'd be very careful about accessing it, but I understand why people do.
Okay, thank you. Yeah, it's a really tricky issue. I think this one probably, well, it could be for anyone. We'll see who's interested, but I'm thinking probably Tanja and Jane might be a bit more interested in this one. Really just looking at what the opportunities that have arisen through the pandemic that, what are the opportunities that we can learn from in building a gender equal recovery? Either of you want to bite on that one?
I'll give some responses.
Okay.
We hear in their perhaps romanticised accounts of silver linings. One of the things I think we have heard is that many men have they've been forced to become more engaged in domestic life. And so men who perhaps might not have spent much time caring for young children or participating have actually found it to be something that they like and they do quite well. So I would like to be thinking about how do we maintain that, because that is really one of the secrets to enabling women to participate more fully economically, is if the unpaid workload is shared more equally. I don't know the answer, but I do think that's one of the things that we're hearing a bit about. Now, this obviously doesn't apply to people who live singly with children or people who rely on 2 full-time incomes in order to maintain family life. But my sort of follow-on question to Richard, whose presentation I've enjoyed a great deal, is how do we really promote the idea that unpaid work is of enormous value to the economy, and it should be made more visible and in some way valued in this economic planning?
Right, I'm going to let you through with that one because there is actually a question very similar to that, but I will come back to you, Tanja, in a moment for that question that we've just gone. But go ahead, Richard.
Oh, you want to answer that one now?
Sure.
Well, how do we make people do anything? I'm not sure, but let me talk about why we should. So I talked a lot before about the economy, GDP, gross domestic product. And gross domestic product is just, it's an accounting identity. It's just the sum of all the transactions, all the things we bought and sold last year. So once you, and I'm not suggesting everyone needs to, but let me just give you a quick lesson in how silly this stuff is. Gross domestic product adds up all the stuff that's bought and sold. Simple way of thinking about it. So if I stop doing my washing at home and take it to the laundromat, then instantly it gets valued in GDP. Because if I do it myself, there's no transaction, there's nothing to measure. And similarly, if I cook myself dinner, we value the carrots, we value whatever ingredients I bought, but the cooking process is worthless. And it gets better if I grow the carrots in my backyard and I make carrot soup at home, it's entirely worthless. But when I say it's entirely worthless, I mean it's not counted in GDP, which is different from economists don't recognise the value of that kind of production. Now, let me just push it one step further to make it really weird for you. If I live next door to you and I do your laundry for 20 bucks and you do my laundry for 20 bucks, then GDP just went up by 40 bucks. Genius, we just caused economic growth. But of course, nothing's happened at all. We've just taken some transactions or some activities that weren't being measured and plonked them into the measured space. So there's fundamental problems with obsessing about GDP in the first place, fundamental problems. And and we know this, because so much unpaid household work is done by women, the accounting framework massively undervalues the work that women do. It's not, the national accounts aren't sexist, right? It's our society that's sexist. But the consequences of our society are that we obsess about measuring, you know, how much you spend on your cafe meal, and we completely ignore all of the household productions, brackets, that's most often performed by women. So this is a real problem for us, because when people work longer hours and spend less time at home caring for their kids or caring for their parents, we don't actually record the lack of production. You know, we under-measure all sorts of important things. We miss whole shifts. So, you know, I know I haven't answered your question, how do we make people care about this? I think part of the answer is, well, we just actually have to make people focus on what's important, not what's measured. I'm not anti-measuring the size of the economy. It's fine. It's a useful enough number. But no family would say, oh, we had a great year. You know, one of my kids got sick, the other broke his neck, but I got a pay rise. So if we just focus on income, I had a great year. Well, you know, in Australia, if we ruin the environment, we've stressed our social services to capacity, but we bought more coffee off each other. It's, you know, it's ridiculous to say that we're a better country for it. So we've got to put GDP into perspective, and part of that is reminding people what's not measured by it.
Thank you. And Tanja, I'm coming back to you. Just to remind you back, we were in the question of, you know, some of the positive things or some of the opportunities that have come out of the changes that we've had to make through the pandemic that might actually help us, you know, move towards a gender equal future.
I think just building on from what Richard's just has said, you know, we have an opportunity to change the narrative.
You need to speak up a little bit, Tanja, sorry.
We have the opportunity right now to change the narrative about what is considered to be productive. You know, it's not just, in addition to those things that you mentioned, Richard, I'll use the example of milk. You know, breast milk is not valued, but powdered milk is valued. COVID presents an opportunity for us to redesign the way that we are valuing a whole range of different, you know, economic indicators. And, you know, I guess women's-based organisers, feminist economic theory has been arguing this for a very long time, but it takes a significant economic crisis for us to start to see just how much of a day-to-day impact this fake economy, incorrect economy is.
I'm also just thinking, Tanja, some of the practical things, like, so I heard, you know, some women with disabilities talking about, for some women with disabilities, feeling more connected rather than less connected at the moment, because they can actually use online ways to connect with people where normally they've been, you know, at home on their own, or the flexible workplace kind of changes.
About that, Kristine, I mean, I think the capacity for us to talk like this digitally is profound, and it's a huge opportunity for people who are committed to rethinking an economic approach to network internationally. I mean, we've had Gen Vic has hosted leaders from Hawaii, from Bogota in South America, and also in the UK. We wouldn't be able to afford to do that without, you know, the capacity of Zoom technology. So COVID is also breaking down borders for organising, I think, and I suspect that it will be quite a significant impact. I don't think we've fully appreciated how powerful that is. In terms of work-life balance, I mean, I think there's I believe that there are a number of women who don't want the isolation to end. It is easier to manage work-life balance and working from home for many women by not having to have enormous requirements for travel and what is basically presenteeism over performance and outcome. So, you know, I think, I know just anecdotally from in the outer eastern communities that I'm in, where there's a 45 to an hour and a half travel every day into the city, that women who have had the opportunity to work, particularly maybe in the public sector, but also the private sector, flexibly from home, they are more productive because they don't have to spend so long on public transport or in their car. They are more happy to be able to be involved in their children's lives while still delivering outcomes. So I think that, you know, there are workplaces have got an opportunity to fundamentally change.
Yep, absolutely. Okay, thank you. Did you have something you want to add there, Jane, or not? Doesn't matter.
I endorse it. I think she's expressed it very well. I think these are all sorts of things that would be really good to be open to maintaining or enhancing, rather than thinking what we're seeking is a return to how things used to be.
Yep.
Yeah, and can I just add, yeah, I just want to endorse everything that was just said as well, and just take it a bit further. The habits that we got into in 2019 are arbitrary, they're historically unique, they're internationally unique. There's nothing innate about working 5 days a week in an office. You know, go back 100 years, a lot of people work 7 days a week. Go to Northern Europe, and a lot of people have 8 weeks holidays a year. So the norms that we've accumulated in the Australian labour market are historically and internationally unique. There's nothing normal about them. They just had become our normal. And after this crisis is over, there's just absolutely no excuse for managers to say to staff, if you're not in the office where I can see you, you're not doing your job. Like, we've just had 6-month experiment, and it shows that for some people in some industries, there is no need to go to the office at all, arguably ever again. Now, that's not true for a chef, and it's not true for a nurse, but, you know, let's be sensible in this conversation. There's clearly millions of people who can radically change what's normal at the end of this in ways that will save them a fortune on transport, in ways that will make it a lot easier for people with mobility disabilities to perform jobs that people thought couldn't be performed remotely before, and in ways that will help people with caring responsibilities, whether it's for their kids or their parents or their dog. It just doesn't matter. What we've just seen is that you don't have to sit in the office all day.
And I think that's the challenge for us now, to be starting to talk about what are the good things, really starting to pinpoint the things that have actually helped and could help into the future, so that we don't all of a sudden just revert back, and that we really do make sure that we take, you know, recognise the things that could be brought into a new future that will, you know, make things better, and particularly that will make for a more gender equal future. I've got a question, Jane, in the Q&A bit here, saying, referring to your comment about normal human reaction to an abnormal situation, and saying what might response to this look like at a policy and practice level without relying on the diagnosis pathway alone?
Well, thank you. And I think this is a question that requires broader consideration. But to me, if we label people's legitimate distress in the context we're in at the moment as being sick or pathological or somehow a reflection of illness, that actually suggests there is another way of responding that other people might have that is the norm, and theirs is an abnormal one. I really don't believe that. I think a lot of the distress that we see reflects the circumstance, but largely reflects social and economic disadvantage. And as Richard described, people who have the good fortune to have a safe job that's continued, a comfortable place to live, they don't live alone, really their mental health has been shaken a bit but not challenged in these ways. And so I think it's very important we don't just respond by increased psychiatric services, because I don't think they have a good record in terms of improving people's safety, finding people productive ways of participating economically, improving social connection. So I think we need to think much more broadly about how can all of the responses to the pandemic and the restrictions in particular be done in a way that enhances people's capacity to participate socially and economically, to have safe places to live, to be able to interact with each other freely. And in my opinion, their mental health is likely to recover through those strategies more than through having a lot of medication or individual counselling. Notwithstanding that those are important resources for some people, but I don't think they're the answer for the whole population.
And can I just push you a little bit more on that, Jane? Then there's a lot of people in the room who would be from a kind of health promotion background, and thinking about what might a project or program look like that would support women's mental health and wellbeing. What sorts of things would we be looking to address?
Well, I'm really committed to the fact that these shouldn't be imposed by people, you know, like me, who've had the privilege of investigating the problems from an academic perspective. I think we have to engage carefully with co-design and broad consultation. I think that recovery is likely to come as the things that maintain most of our well-being, which is liberty, autonomy, ability to see the people we want to see in the ways we want to see them, having a purposeful activity, I think it's likely to recover a fair bit with those things. But I think it's even more likely to recover, in particular, if women feel an increased sense of agency. So if, as we recover, we think we maximise the ways in which women can participate in their households, their communities, society, economically, and that to me would be one of the very great benefits that might come from this.
Okay, fantastic. Okay, here's a pretty general question for anyone who's up for it. We're really looking at, advancing gender equality, and I guess for us that's very much looking at all women. So, really recognising that if we want to advance gender equality, we need to look at women who are already disadvantaged because of other forms of discrimination too. So what is key to achieving a gender equal recovery that will leave no women behind? Anyone game for that one?
I'm happy to.
No, go on.
No, I got no idea how you achieve it. Look, it's obvious. We've never in the history of ever has a government said, so we're going to spend a couple of $100 billion, $100 billion, just found it behind the couch, going to spend it, just haggling about who gets it. We've never, ever, ever been in that position before. But if we spend that money giving me a tax cut, then we're going to make the gap between me and a low-income woman bigger, not smaller. So how do we do it? Well, we target that spending at both income support and service support for the people who need it the most. That's how you do it. It's not hard at all.
Yep.
Making elected governments do that's the hard part.
Yes. But I do think it certainly starts, and Tanja, you talked about this, about the importance of having sex disaggregated data, but also perhaps data that, and Jane, you did a little bit of it in your survey, and we're hoping to get more in the latest version. But, we need to be collecting information about who are the groups of people that are most impacted, and certainly for women. We know, for example, Tanja, you talked about frontline workers. We know there's a lot of migrant women who are working in those frontline jobs in aged care and retail and abattoirs, those sorts of jobs. And so, we need to really be, I guess, making sure that we're thinking about all those different groups of women, making sure we're collecting the data that will help us to kind of advocate, I guess. And as I said, I still don't know how we make government do it, but at least have the advocacy information to be able to say, well, we need some of that enormous amount of money spent in these areas, I think.
I think one of the things that we've become really concerned about at Gen Vic is the extent to which treasuries drive so much of the policy outcomes. So treasury choices end up shaping a large part of public policy. And where this becomes a concern for gender equity advocates is if you don't have expertise sitting within Treasury or working in community and in the academy, working in parallel with Treasury, who understand how to use the levers of the economy to benefit men and women equally, you are never going to address the fundamentals of what Richard is talking about in terms of how deep these problems are. And so we've been talking about the need for there to be investment within government in the resources that would have the expertise that we know is out there. Richard is one voice. There are many other female economists who are basically sitting with expertise on how to address the care economy, who want to talk about the connection between childcare and productivity. They need to be brought into Treasury and start thinking through the solutions. Our concern is that there's been a bit of a gap. It's partly about a gender gap in terms of resourcing. It's a little bit of an ideological gap. You've got the National Foundation of Australian Women who are performing a post-budget analysis every year for free. They don't get funded to do this, to assess whether the budget is actually gender equal. Well, actually, you need to bring the NFAW and Gen Vic and other gender-based economists into the centre of the decision-making to fix if you want to have a gender equal recovery. And I'm not convinced yet that any government is prepared. I think treasuries hold that expertise really tightly. The kind of economic theory that Richard, myself and Jane are reflecting on is not always commonly taught within the pedagogy of mainstream economic study. And so we've got a bit of an uphill battle to do, the change that we need to do within those governmental structures.
Okay, thank you. We've only probably got time for a couple more questions, so I'm going to combine a couple. So I've got one from Edvos that asks about what can service providers do to support this cause and advocate it. But I've also got one in the chat here of someone saying, what can individuals do? So yeah, to really drive a gender equal future. Any thoughts?
Well, can I ask, I mean, we need organisations and individuals to put pressure on their government representatives at all tiers. So at a local government level, a state government level and a federal government level to basically deliver on a gender equal recovery. And I do think that the slight change in conversation around construction versus public sector investment is coming because there are voices talking about it. The more that, if it's just talking heads in a forum like this, it won't be enough. It needs to be a conversation in social media. It needs to be a barbecue stopping conversation that we can't just, and I keep talking about, this cannot be an economic recovery where there's a 2-lane recovery, where men are on a fast track and women are in the slow lane. That's not a recovery.
Yeah.
That is not a recovery. And
I completely agree with you, Tanja. And I think I said earlier that everyone does have a sphere of influence. And I think whether it's the people in your backyard barbecue or, you know, whether you're a policymaker, it doesn't matter. I think everyone just needs to really start raising these issues, pushing them. And I think it's interesting that we still, a lot of us, even in our role, my role, you know, feel like when you start talking about, well, what about women, that you're somehow pushing some, you know, odd, you know, barrow, where actually we're 51% of the population. So it should just be normal. It should be standard practice that with any issue, with anything that's going on, that we're looking at how it affects men and women and people of different genders differently. And I think it just needs to, people need to get comfortable talking that language, I guess. Okay, what have we got? We've got a question here. I think we've kind of covered off, but if anything to add on the importance of free or affordable childcare, both for women's employment, but also for their mental health at the moment during COVID. I don't know, Jane, if you wanted to comment, particularly with the mental health focus.
Look, I think access to trustworthy, high quality care of young children is essential to women's emancipation, to enabling them not to have a huge gap in their economic generativity, but also in their own capacity to grow in their skills, their ways of making broader contributions. I think that many families at the moment who've experienced confinement with young children have missed having access to that, but some have also said they don't want to go back to their children and being in long daycare 5 days a week. So I think it's one of many topics where we need to have really a wide community conversation about what are the best ways of doing this as we progress into the future. And certainly high quality childcare is essential, but for that to be provided, childcare providers and educators, they require access to good education and skills building and fair and equitable ways of being waged. And at the moment, those are not available to them. So it's a revolution in what's provided and in access to it, I think.
Oh, thank you. I've had a few questions on the upcoming budget in first week of October, and I think Richard, you've probably already talked a bit about the tax cuts and them not necessarily helping a gender equal future in any way, probably widening that gap. But are there other, and also the fact that we are, we're in a recession, how big a deficit should we feel comfortable with, and what are the key things that we want to see in that budget? Again, I think we've touched on this a bit, but if anyone wants to, I'll start with you, Richard, but also Jane or Tanja, if you want to add anything to that conversation.
Yeah, sure. Look, we've had decades-long obsession with budget surpluses in Australia, and that's gone now, and that's a good thing. Donald Trump, Republican, has a budget deficit in the US of around $1 trillion. The Republicans have never delivered the budget surplus in the US, never, ever, ever in modern times. So the idea that we have to have a budget surplus or we're doing something reckless, it's just not true. It's never been true. Countries like America do exist. Countries like Japan do exist, run enormous budget deficits. So hopefully we've killed off that sort of, fairy tale story. And once you kill that fairy tale story, then we can open up a democratic conversation about, well, okay, what do we want to spend money on? And we've avoided that conversation for decades by saying, well, you want to spend money, I want to have a budget surplus. Who's more important? Well, no one wants a budget surplus anymore. It's gone, 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 gone. And I'm repeating myself, but it takes a long time for people to hear this. It's gone. So when you make your case for spending now, just make your case for spending. Full stop. That's it. No offsets, no tax, nothing. Just make your case for spending, because that's what the construction industry is doing, and that's what the mining industry is doing, and that's what the gas industry is doing. So, I just think people have to change their whole mindset. Economics hasn't changed. Economics is the same as it was a year ago, but politics has changed radically. And at the moment, the groups that understand that are the gas industry, the construction industry, the mining industry. You don't hear them talking about budget deficits. You just hear them saying, give us money. And they're getting it.
I think in the non-for-profit sector, we're all pretty, caught up with, oh, well, there's going to be no money around. And as you've pointed out, those sectors, all gas construction, are getting plenty of money and are producing very few jobs. So, I think that focus on really, for us to, say what we need, and to be clear about that, and that we are, and that will produce jobs, actually, if they're looking at work in the community sector. So I think that's a really important thing to focus on. Did you have anything else you wanted to add, Tanja, to that, in terms of like a wish list, if there was something you wanted to see in the budget?
Oh, look, I think that my wish list is quite long, but it was long before COVID-19. I mean, the reality is that we don't have gender equal budgets. We just don't.
Yeah.
This problem has been going on for a very long time, and we have marginalised workforces, marginalised sectors, and underinvestment in things that can create lots of jobs and solve problems like childcare, which is deeply connected to productivity. It beggars belief. If you've got something which is going to lift GDP by as much, and I know that I had my screenshot earlier, there's a 35% potential lift in GDP if you invest in gender equality. These are international pieces of research now that are proving this. If you want to lift profit in a private sector organisation, the best way of doing that is to introduce gender equal measures within your corporation. That's a 30,000 organisation study by the Peterson Institute. It's not like, if we want best practice for economic recovery, we have to do this. So it's actually bodgy politics, bodgy economic outcomes if we're not doing it.
Yeah. And very least, it would be nice for there to be some analysis of the budget in terms of its impacts related to gender.
But we won't be funded to do. We're not funded. We will do it.
Yeah. Okay, what's the time? We need to wind up, I'm afraid. I've got one last question. I'm just going to throw out quickly and then we will definitely wind up. And it's from Positive Pathways Training and Executive Coaching. We've kind of touched on it. If you've got anything you want to add very quickly, it's how do we keep the dialogue going around the impact of COVID on gender issues and inequality and on a gender equal future? How do we get people to keep talking about this issue?
Oh, my tip would be don't talk about the economy. Talk about people in the economy. Like, don't talk about the labour market. Talk about people in the labour market. When people say it'll create jobs, ask for who. When people say it'll be good for the economy, say which parts. You know, the idea that there's this abstract thing called the economy, you know, well, go to Google Maps. You get a picture of anything except the economy. Like, I can't find the economy anywhere because it's an abstract concept, you know, and that's okay. We can talk about the community. That's an abstract concept. We can talk about our culture. That's an abstract concept. But when someone says Australian culture is this, we interrogate that. So what do you mean? Is there only one culture in Australia? Of course there's not. So just don't take the bait that there's this thing that's good for the economy and what you want is bad for the economy. Force people to talk about which bits of the economy that something's good or bad for.
Very good advice there, I think. Unless anyone wants to add anything, I think we might wind up. Did Tanja or Jane last opt? No?
Thank you.
Okay, so look, thank you very much. In closing, I would particularly like to thank each of our amazing speakers who have provided us with engaging and insightful presentations today and conversations. You have helped us think about what we can do to elevate the discussion about the impacts of COVID on women and push for a gender equal recovery. I'm hopeful that the forum has provided us all with food for thought on how each of us might be able to contribute to making change. Whether your role is in setting policy, whether it's developing funding guidelines, delivering programs and services, or whether you're a member of the general public, we just do all need to remember that we do all have a sphere of influence and we all have a role to play here. The challenge is pretty much the same. We need to speak up about the gendered impacts of COVID. We need to use our influence to build a fairer, safer and more equal society as we continue to deal with this pandemic and as we move towards recovery. So you can be sure that at Women's Health East, we will be continuing to fight the good fight. We hope that you will be there alongside us and we hope to keep in contact with you all. So we will be sharing the recording with those who've registered. Thank you all for coming along. And we've just got a very short 2-minute poll that we will get you. Honestly, it won't take very longer than that. So if you could just hang on a minute and just answer a few questions. And I think we can probably take ourselves off video to the panel, but thank you all. And thank you all for coming. And if one of my team can launch the poll now, please. Here we go. We're going to leave that up for a few minutes. There's only 4 questions there. I can see the responses coming in. Thank you. Okay, we've still got quite a few people in the room, so you're obviously answering the poll, which is very good. We really appreciate it. Really like to get some feedback on how our events have gone. And I think it looks like it's slowed down now. Last minute, if you can jump on and answer those questions. All right, I think we might leave it at that. So thank you, everybody. Really appreciate you coming along and your questions. And appreciate all the speakers, and I hope you have a good afternoon. So thank you. Bye-bye.